Pakistan's 2010 flooding, the worst ever natural disaster in living memory, uprooted the lives of around 20 million people, which is equal to the whole population of Sri Lanka. These floods have highlighted the large number of people living across rural Pakistan that do not have even basic health services. Of the whole affected population, an estimated 70% are women and children. Most affected communities had to flee from their houses. Some had to live under open skies, using their charbais or bed for shade. Others were lucky to be offered tents. Families that brought livestock with them had to make their own arrangements, as they could not be accommodated in the camps. After the worst floods that hit Pakistan since 1929, UNFPA estimated that more than 500,000 displaced women were pregnant. Every day, some 1,700 would go into labour. These women might not survive without medical intervention in a referral-level health facility.
Volume of people displaced, wherever I went, just overcrowded, and condition is not hygienic.
With an estimated population of 168 million, Pakistan is the 5th most populous country in the world. Pregnancy and childbirth are the leading causes of death, disease, and disability in women during reproductive life. They are the single contributors to the burden of disease in women in the age group of 15 to 49. In Pakistan, the maternal mortality rate is 276 deaths per 100,000 live births. This means that roughly 1 out of every 89 women in Pakistan will die of maternal causes. In the rural areas, the maternal mortality rate is almost double that in the urban areas. Tragically, it is the rural areas that were the worst affected, where the lives of many women were little better than before the floods. In a male-dominated rural setup, they are used to living a life marked by extreme poverty and gender discrimination. The discrimination against women is also a great concern for UNFPA.
Like awareness and advocacy, these are the two things which are required at this moment. And along with some practical kind of activities, practical kind of services which are in place for the people, and they know where to go and whom to contact.
What we're trying to do here is to create a pathway, literally a pathway that survivors can go down to get a range of care.
These women usually have 4 or 5 children already and come from rural areas with inadequate health facilities. Most of the displaced women are malnourished, extremely anemic, and often fatigued by the long journey some had to make to reach a campsite. Nahid, who underwent a safe delivery, was lucky enough as she ended her flight from the flood in a camp in Sakhar, visited by a UNFPA-supported medical team.
जो ज़्यादा पेशेंट हमारे पास यहाँ पे आ रही हैं तो उनके ज़्यादा बच्चे हैं, मल्टी ग्रेविड हैं, एज ज़्यादा है उनकी, तो उनको हम थोड़ी काउंसलिंग करें कि आप जी बर्थ स्पेसिंग करें.
While the total fertility rate for the poorest quintile is 5.8, it is half of that for the richest quintile. 3 out of 5 births take place at home. Traditional birth attendants or DAIs assist with more than half of all deliveries.
ये जिस इलाके से आए हैं वहाँ एटलीस्ट अल्ट्रासाउंड की भी फैसिलिटी नहीं थी या इन लोगों ने नहीं कराई, इतनी अवेयरनेस नहीं थी, तो काफ़ी पेशेंट्स हमारे साथ तकरीबन 99% आप कह लें जिनका अल्ट्रासाउंड भी नहीं हुआ था और एक सिंगल ब्लड टेस्ट भी नहीं हुआ था। नई जो पेशेंट्स होती हैं उनके हम पूरे टेस्ट करवाते हैं और अल्ट्रासाउंड की फैसिलिटी देते हैं और अगर किसी को इमोक की रेफरल की ज़रूरत है तो वो भी हम उनको एडमिट करा देते हैं हॉस्पिटल्स में।
UNFPA has 40 years of experience meeting the reproductive health and gender needs of communities in Pakistan. In Pakistan, UNFPA, as part of its emergency response, provides comprehensive reproductive health services, coordinates prevention and response to gender-based violence, and provides hygiene supplies and psychological support services. Working in more than 25 flood-affected districts, the fund mobilized 54 health service delivery points, mobile service units for outreach services, referral and basic level health facilities. The mobile vans have proved very practical for delivering services where there are no health facilities or they have been damaged. Some vans were parked next to hospitals or health centres and serve as static service delivery points.
Whenever there is an emergency, UNFPA initiates its response to that particular emergency. We are taking the example of recent floods in Pakistan. And this whole response is basically based on a UNFPA document of minimum initial service package, which is called MISP. This MISP is implemented throughout the world in any kind of emergency, and that is a tested document and tested strategy.
UNFPA is not only working for reproductive health, but is also providing services to the IDPs who have been uprooted from conflict-ridden areas. Not only is UNFPA helping these affected people, but it is also catering to their needs by providing vocational training for men and women.
One thing that we've been promoting in UNFPA are these livelihood interventions, kind of centers where women can gather, learn embroidery, or learn computers, or learn tailoring.
The UNFPA has helped to assess needs for basic health services and is working to restore health facilities as the widespread devastation has damaged or destroyed a great number of health units and hospitals in all the affected areas of the country. Besides supporting health authorities, the fund has conducted reproductive health training at provincial and district levels and offers critical supplies to NGOs ranging from clean delivery kits to medical instruments and essential medicines for clinics offering safe deliveries.
The catastrophe is so big and so huge that it has been very difficult for us to cater for all those who have been displaced or affected. However, we have been doing it to the best of our efforts, and especially through the efforts provided to us by our UN partners, especially UNFPA, in expanding its activities beyond the 2 basic districts that it was working in, and expanding its activities in 7 or 8 other districts.
The fund has also worked with humanitarian partners to ensure that gender considerations are factored into camp designs and that the protection needs of women and adolescents living in camps are not ignored. Donors responded generously to UNFPA's initial appeal for funds to support relief activities, but more funding is needed to scale up its efforts and re-establish damaged or destroyed health facilities. The fund enlarged its partnerships to extend the coverage of services.
Now we are shifting focus on the early recovery period. Needs are so enormous and competing, so we want to make sure that not we only deliver specific services, we want to combine as many services as possible to deliver, because we can never meet the demand.